Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. In this segment, we're going to be having a conversation with Mr. Eric Bednash. He's CEO and co-founder of RackTop Systems, an innovative cybersecurity company. He's going to talk to us about protecting data within the healthcare industry, especially since there was a significant number of providers that have suffered some data breaches in the past couple of years. Welcome to Health Professional Radio. Eric, how are you?
I'm great, Neil. Thanks for having me.
So what is your background? Are you an IT professional by trade or entrepreneur or a combination of the two?
I would say I'm a combination of both. Mm-hmm. I think by way of experience, I've spent the majority of my career in national intelligence, mm-hmm. Specifically at sort of the confluence of data and cyber. And so, what we do at RackTop today is really largely informed by over 2 decades of experience of dealing with, really complex data security issues, really centered around, protecting data.
We've been hearing a lot, especially in the last couple of years, about inequities in healthcare, people not getting the care that they need, people not going to the doctor for this reason, that reason, the pandemic reason. But I personally haven't heard a lot about security data breaches within the healthcare industry. When you think about it, I guess that would be some of the most valuable information to steal.
It is. And actually, interesting enough, 2021 was the second worst year for data breaches in the healthcare industry. Over 44 million records exposed or stolen. So it's happening. It's out there. I think if you read the headlines, you'll see it buried amongst other breaches and exposures. But healthcare is definitely one of the biggest targets, and it has been for the last few years.
Are we talking targeting hospitals, insurance providers, emergency clinics? Who's being hit the hardest?
It's really, the category kind of lumps all of those together, whether it be healthcare related industries, hospitals, organizations. I think if you sort of went back and looked at, the individual headlines, you'll see a lot of hospitals, a lot of individual healthcare organizations, and the impacts are different across the board. Some are data breaches, some are ransomware attacks. When we talk about sort of the risks in general to healthcare organizations, whether it be a vendor or be a healthcare provider, whether it be a hospital system, there's a number of risks that they're facing, and it's really just not around breaches. It could be the loss of service and the ability to deliver care. It could be permanent damage, right? Something like a ransomware attack that's unrecoverable. Mm-hmm. That could lead to legal compliance ramifications, or the worst would be a loss of life situation where you had a critical resource that was compromised or overtaken by a hacker, or critical data that was needed at the time of a surgery, and that wasn't available, and that could lead to significant consequences. And we've seen a few of these cases globally in the last year.
Now, when it comes to someone stealing a person's medical records and medical information, are we seeing a correlation in, say, a data breach at a major provider and then a rise in certain types of scams?
There are these, the different types of threats that exist, or, malware threats or attacks or scams, or however sort of the breach is initiated. It starts somewhere. And, a lot of times this could happen months or a year or longer before the actual breach occurs. And a lot of times that happens through phishing, or it could happen through some malware, could happen through emails, could happen through text messages now. That's something that I've personally experienced recently. It's just any which way that can get the threat into the infrastructure, into the ecosystem. And then once it's in, it's kind of like a virus. And it'll sort of spread at its own pace, depending on how it was developed or designed. And so, a lot of times there's correlation, but a lot of times there isn't, because we're finding out about these breaches or attacks almost a year in some cases after they've already been exposed, after the organization's already been exposed. So, it's hard at that point in time to sort of correlate between how it began and, how it ended, which ultimately is with the data breach or a ransomware attack or something that resulted in loss.
So it seems that no matter what a company does, there is always going to be the risk of someone stealing their information or a ransomware, malware. There's always some type of risk. We trust these systems. Should we?
No, it's less about trusting the systems. I mean, so zero trust is sort of a way to describe sort of a structure for how an organization would go about thinking about security. It's not so much a prescribed implementation, but it's really a framework for how, when you think about how you should secure your infrastructure, your digital assets, what you should be thinking about. But if you just want to rewind to the first part of your question in terms of are we always at risk, the answer is yes. And this is a dramatic change in how we've built our IT systems, built our infrastructure over the last 2 to 3 decades. And it's, all of these were built on sort of this inherent model of trust, where if the bad guys are kept on the outside, meaning that beyond the perimeter of our infrastructure, beyond our firewalls, then we're safe. And what we've seen really in the last few years is that notion really doesn't hold true anymore, which is why you have things like zero trust, which is really about our systems are no longer in any sort of environment that should be perceived as a safe environment. And if we think about that, then we will implement, or the thought is we would implement precautions and proper controls and measures with the assumption that something bad is going to happen at any time.
Well, give us an overview, if you would, of how RackTop Systems is addressing this problem.
So at RackTop, it really starts with our philosophy, and that philosophy is rooted in our experience. As I mentioned, myself and my co-founder spent a large part of our careers prior to RackTop really focused in the areas of really securing the world or the nation's most critical data. And, that whole idea of trust or trusting our systems or trusting the protections we had, it's really not an option when you're treating something so critical and special, right? Think about if you had a major organization and your most critical IP, you want to make sure you protect that at all costs. And so it really starts with a different philosophy and a different view. And so instead of taking the traditional view of what I call solving doors and windows problems, kind of put in the infrastructure controls to keep the bad guys out, our philosophy is the bad guys are in. There is no concept of in and out. And so we took a look at cyber and the whole cyber industry from a totally different perspective. And that perspective is from the data's perspective. And that data is really in a constant state of vulnerability. And so what we do at RackTop is we protect that data. We provide a capability, a software product that enables any organization to protect their most critical assets, the data, as if it were a national secret. And we do that by approaching the whole cybersecurity problem from a zero trust perspective and from the perspective of the data and the data always being in a potentially compromised position. And because we do that, and ultimately when you do that as an organization, you actually can stop the threats that are impacting you because you are not, missing kind of the spot within your infrastructure that typically you don't pay attention to because you're thinking it's okay.
Is that typical lack of attention always paid to outside sources? How about the sources within your own organization who have access to that information? Are we putting our trust in them, or do RackTop Systems take inside jobs into account as well?
Yeah, so that's a great point, right? We think about the external threat because it's visible, but we don't think about the insider threat. And I mean, sometimes you don't want to, right? You don't want to think that the people you hire are inherently bad. You also don't want to think that maybe you hired somebody who was intentionally trying to steal from you. So these are things like, as humans, we don't like to think about, but it's a reality. And, a lot of these breaches occur from people who do have access, or people who misuse their access, or people who don't even unintentionally use their privilege to perform a particular operation, like an administrator. They don't utilize that in a manner which is completely secure, in which then those credentials could be compromised. And then, essentially that's still an insider threat. Even though maybe an external resource has caused it, it's still an insider threat. And so we have to not think about individuals and people, right? We can't think about that. That's the legacy way. That we thought about the problem that way for the last 2 to 3 decades, and that's okay, because that was the problem. But we have a data-oriented problem right now, so we can't think about the person performing the act. We have to think about how they do it, the behavior. And if we look at the behavior, then the person becomes, it's really not about an individual, good or bad. It's about the action that they're taking. Is that good or bad? And then that's how we could actually determine whether or not an insider or an external threat is doing something malicious, because it's really about what they're doing and how they're doing it, not necessarily who they are.
Give us a website, if you would, where our listeners can learn more about RackTop Systems.
So to find out more about RackTop, you could find us online at www.racktopsystems.com.
Great. Eric, it's been a pleasure speaking with you. Lots of great information. Good luck in your future endeavors, and I'm hoping that we'll have an opportunity to speak again.
Yes, Neil. Thank you very much.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Eric Bednash, CEO and co-founder of RackTop Systems. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.